Welcome to the Enloe Quality Summit. I am Dr. Scott Schneider. I am the chair of the PIPS committee. PIPS stands for Performance Improvement and Patient Safety. It's essentially our quality committee here at Enloe. 17 years ago, an idea arrived on the shores of Enloe. A group of visionaries had been watching the idea from the shore, awaiting its arrival. Many of those same visionaries who were there 17 years ago are here with us tonight. That idea was the actualization of this concept called quality. Actualization implies a process recognizing in one's own self your full potential, realizing your own possibility for improvement and carrying it out in such a contagious way it helps create a system of healthcare that changes how patients experience their care, a sense of belonging. We are here to celebrate those for whom year by year, month by month, day by day, that idea of excellence has grown. This event allows us to place that idea up on a pedestal for display. 14 times since then, we have called that pedestal our Quality Summit. This afternoon, I say to you, welcome to the 15th, mostly annual Enloe Quality Summit. We've had to postpone our celebration of quality for disasters, impending disasters, for floods, for fires, for global concerns, and for regional crises. We have refined our excellence in those crucibles and come together for a 15th time today to celebrate that quality. The Enloe Quality Summit is a checkup, much like a visit with your own physician or care provider. We ask, how are we doing? What have we been doing to better ourselves? What can we do to continue to care for each other, our community, and our region? This year's submissions tell me that we are happy, healthy, growing, and continuing our focus on core values of safety, engagement, trust, excellence, and belonging. Quality can be concisely summed up as excellence in being. Excellence has always been a part of the secret sauce that makes Enloe the special place that it is today. It resides in the quiet look between a patient and a caregiver when their eyes first meet. It's there for the Kentucky Derby style bell signaling the start of another full surgery day. It's present whenever the extra effort is made to get a patient into the treatment bay in the emergency department to be seen. It is not always the focus of our day-to-day operations, it's the background music. This subtrack gently urges each of us to go further, to try harder, to continue to make a difference. Quality Summit is about stopping for a minute to listen to that sweet background music, our excellence in being. It's about celebrating all the ways that excellence has made a difference and will continue to make a difference even after today's celebration is over. Some of the key aspects of quality in healthcare at Enloe are represented by 85 posters submitted this year. Some of those ideas and concepts are safety, effectiveness, patient-centeredness, timeliness, efficiency of care, equity in our care, improve patient outcomes, increase patient satisfaction, reducing costs, enhancing trust, meeting and setting quality measures that improve our initiatives. Data collection and analysis is the base of this all. There were so many excellent submissions this year, 85 in total. The groundswell voting and analysis of measurable metrics helped us narrow the field. By focusing on the categories above and demonstrating the scope of effective quality improvement, we were able to arrive at our 3 winning posters presented this evening. I'd like to call Dr. Sean Maiorano to the stage to announce the first.
Thank you, Dr. Schneider. You know, as we do this, one of the things that's kind of really fun is to sort of hear from our colleagues. You know, we work alongside each other, but, you know, an opportunity to put pen to paper or pen to typing. Such nice words. And Dr. Sarbu also impressed me last year, and I feel like I'm going to fumble through this because I'm not quite as eloquent as you all. So once again, it's my pleasure to participate in this year's Quality Summit. This marks the 16th anniversary of a very unique event. We sometimes overlook how integral this event has become to our culture and our identity. The Quality Summit has become part of our DNA. There's rarely a time when we meet new physicians that we don't mention this event. or speak to it when we're describing the transformation that Enloe Health has undergone over the past 16 plus years. We can all be proud of the work that is done to sustain the excellence in care and quality. Today we have organized an event to recognize the contributions from all areas of our institution. We are committed to continually redefining the quality based on the insights gained from our experience and the ongoing process improvements. Reviewing the 85 submissions this year, it is evident the substantial work that has been carried out by every unit, clinic, or workspace. Every year we are given an opportunity to gain insight into the work that we all do. From new patient workflows, new technology, or rethinking how we deliver care at the bedside, your efforts are impressive. With the 85 submissions and only 3 awards to give, it's a daunting task to pour through all these projects and settle on just a few. As we review these posters, I'd like to say thank you for all of you who have participated this and previous summits as well, and taking the time to create projects and do work that is so valuable to Enloe Health. Before we actually speak of the 3 winners, I do want to call out some notable posters that stood out among the 85. The first poster number 1, was standardizing order sets. I'll give them a little clap. While at its face value, this may seem not as impactful to some, the savings of time and unnecessary burden of medical records for physicians, providers, and nursing is invaluable. At the time of that poster, there was nearly 6,000 orders that were standardized and prevented multiple phone calls and order entry from various members of the staff. Poster 44, the MERP, 25 years. Medical Error Reduction Program. As stated in their poster, they are a shining star of patient safety from its inception in 2001. Following the To Err as Human publication from the Institute of Medicine, the MERP committee has been a steadfast team of clinicians, pharmacists, nurses, and staff who regularly review thousands of orders to confirm safe administration and implement safeguards to reduce the chance of harm to patients. Poster 50, the Community Health Vaccine Clinics. A small but mighty project, the community health team was able to provide outreach to 14 sites, providing access to vaccines to vulnerable and at-risk populations around the county. Poster 30, Patient Care Support Tech. This poster provided excellent insight to a team that may not be known to everybody or be on your radar, at least to the public eye. The patient care team provides bedside assistance for nurses, allows for patients to be safely transferred, reduces the risk of skin injury, and are key members of the team during critical moments during hospitalization. They serve as valuable members for transport of patients after their passing and during the process of organ donation, and we thank them for their work. Poster number 4 was the BioFire, or BCI2, which stands for Blood Culture Identification 2. This presentation highlights how modern technology and techniques enable clinicians to treat more accurately with a narrow spectrum of therapy than traditional methods and cultures. With it, patients are exposed to fewer antibiotics, costs of treatments are reduced, and their length of stay is potentially shortened. So on to the awards. Last year, we changed our award process to 3 awards. To remind you, the project garnering the most votes is our illustrious Dr. Marcia Nelson, MD Award, the Summit Award. Additionally, we'll recognize 2 other outstanding quality projects with the Quality Awards. Although it was difficult to decide, our medical staff leaders and Board of Trustees have selected 3 exceptional projects. It is my distinct pleasure to announce the first of the 2 Quality Awards. Similar to last year, this shows that our work is no longer within the walls of this building, but within the community. The first Quality Award goes to Health Equity, poster 66. I'd like to read a short section from their presentation, and then we'll call them up. Collecting social determinants of health information, sexual orientation, and gender identity information at a clinic encounter or hospital admission provides the healthcare staff the opportunity to intervene for the patient. Patients who struggle with housing costs, utility bills, or paying for food may not be aware of the community resources they can receive. They may be faced with tough decisions such as, do I pay for my medications? Do I pay for my utility bills? Patients can be provided with resources and referrals to improve their situation, thereby improving their health. I'd like to call up Amanda Wilkinson, the manager of case management, and Dr. Annie Miller, director of community health, to receive the award. Just photo op for him. Thank you. I will step aside and let you speak.
Okay.
Oh.
Thank you so much. We are so honored to receive this award for all the work that our committee has done. So I wanted to start out first with a big thank you to all of the people who participated with us in our Health Equity Committee, and a big thank you to leadership here at Enloe who supported and encouraged us along the way. Without everyone's hard work, we couldn't have achieved as much as we were able to do. So the Health Equity Committee was formed in 2023. It was in response to regulatory requirements that were put out by Joint Commission that applied to inpatient patients only. In 2024, we had those requirements expanded by the Centers for Medicare and Medicaid Services when they required us to address even more social determinants of health. And that was also along with other accrediting healthcare agencies like Plaintree and Leapfrog and Blues Distinction. Our original committee started with 15 people. We very quickly realized this was a much bigger undertaking, and we expanded to 33 people who are currently on the committee. This award affirms that the health equity is vital to delivering high quality and person-centered care, ensuring everyone has a fair and just opportunity to attain their highest level of health. The health equity mission addresses systemic barriers to health such as poverty, discrimination, and lack of access to essential resources like housing and food, transportation, and having a safe environment to live in. So what started as a regulatory requirement has evolved into a deeper organizational commitment to focus our efforts on health equity outcomes as we address health-related social needs for patients in both ambulatory and inpatient settings. Our efforts have made a true impact in the community as we've made strides to connect with our partners out in the community who serve our mutual patients. This committee has evolved, laying the groundwork for a far-reaching movement to reduce disparities and elevate the health of our communities. And we have a lot more work to do. And I will let Dr. Miller speak to that.
Really, who should be in front of you are people like Susie Lowry Hall, and people that should be speaking should be Paulette and Susie Benson, because they're all the co-chairs of this committee and have led us through all of this work. So at Enloe, we provide excellent health care, and we strive to help our community to have excellent health. But health and healthcare are not the same thing. They're related. But health is dictated mostly by things that happen outside of clinics and hospitals. Only about 20% of our health really is dictated by our healthcare, and the rest is everything else. Yet the impact we want to make, and often the way we are evaluated and judged, is on the health of the people that we take care of. So one of the roles of the Health Equity Committee is to select those opportunities to improve people's health that complements our excellent health care. Enloe can't and really shouldn't be the solution to a lot of these social problems, but we can identify those problems and connect our patients to those solutions in the community. So I'd like to thank some of our community partners, like the Center for Healthy Communities at Chico State, like Butte County Department of Employment and Social Services, and the local shelters with whom this work really wouldn't be possible. And thank you to all of you for all of the work you do every day to take care of our community. Thank you.
Thank you, Dr. Miller, and excellent work on health equity. Our next winning poster is a perfect example of how you should never settle for the status quo. Poster number 13 is titled Transforming Medical Imaging Services, and that's exactly what they accomplished. If there was an award for honesty and integrity, this one would have my vote. They looked at their own department and asked, is there a problem? Is there a challenge? Is there an opportunity for improvement? That's one of the hardest questions to answer, especially when it's done in front of a mirror. There's a scene from a series on Apple, I believe, called Newsroom, in which Jeff Daniels' character answers the difficult question, can you say why America is the greatest country in the world? He gives a very thought-provoking and compelling answer of why it is not. And then he follows that up with the statement, the first step in solving any problem is recognizing that there is one. Our medical imaging services recognized that there was a problem. They went through the process of asking 5 whys. Why is there a problem? Well, why is that? Well, why is that? Well, why? Until they got to the base of it. And then they built it from the base back up to the top. A compelling 67% improvement in physician reporting to the studies that were ordered, a remarkable turnaround time, and during this whole process, they added in a additional imaging center out at Springfield. I believe that when the question is asked, is there the opportunity for improvement, and answered honestly, the biggest changes and improvements are sure to follow. I'd like to welcome Eric Hutchins and his team up to accept the award. See who gets to talk first.
Well, I'm not talking.
I just want to say it's an honor to be here and representing the staff, the staff technologists, the technologist assistants, the nurses, the leadership, the radiologists who all made this whole initiative possible and helped us achieve what we achieved in getting the delays in reporting solved more and more in our department. At the end of 2024, our department encountered 2 significant challenges, a growing backlog of unreported studies, and that impacted our in-house radiologists, and delays in overnight reads caused by our reliance on off-site teleradiology services. These delays not only affected our ability to provide timely support to the emergency department and to inpatient providers, but also posed potential risks to patient care. Recognizing the urgency of the situation, we took proactive measures to address these issues directly. Several of them included, we implemented a daily tracking system to identify and monitor unreported studies that we monitored consistently daily throughout the day. We expanded our team to include 2 overnight radiology assistants to improve efficiency and reduce reporting delays for the emergency department and inpatient areas in the hospital. And we increased our radiologists on-site coverage to 75% of the time during the month. And that was a big deal. And I want to just say thank you to our radiologists. These efforts led to a 68% improvement in unreported study reads, as well as improved radiology study reporting turnaround times to providers, helping us to strengthen our collaboration with both the ED providers and our hospitalists. We decreased the times for patients waiting for medical imaging services for discharge, a big deal in the hospital these days, as well as decreased wait times for outpatient services, which has really been a thing in our Chico area, and I'm glad we were there to support that. By delivering faster and more reliable radiology reports, we are supporting quicker diagnoses and enabling more effective treatment plans, ultimately enhancing patient care. This was a collective effort by everyone on our team and our department to implement this strategy and to continually, daily monitor and adjust the process to make sure that we had timely reporting for our providers and their patients. We believe these initiatives have helped us deliver a more exceptional healthcare experience and ultimately help to elevate the health of our community. Thanks goes out to everyone in our radiology leadership team for all the sustained work. To Catherine, which I want to point out here, who helped us design the quality poster for the layout for the poster this year, and especially to our radiologists who stepped up to the challenge to keep us on top of our game with their great work. and give us timely results. Thank you. You want to say anything? Okay, guess not. Thank you so much.
Before we have our final award, I'd just like to recognize all the folks that put this together. Certainly Susie Lowry Hall, who's the director of our marketing, communications, and outreach, along with Kathy Cawthon, our director of quality and medical staff, our tech people, our caterers. I'd like to recognize our board chair, Walt Schaefer, who's here today in the front row. You want to just raise your hand? Great. I think this award ceremony has gotten more and more organized over the years. I remember when the first time we put our posters out and it rained, you had the predictable result. Now we've got print services putting together this really nice display. Hopefully enough chocolate chip cookies, at least one will be left over when I'm done. It wouldn't be the event that it is without all the participants. And want to thank you, the physical and virtual audience, for coming and supporting the folks that took the time to put posters together. It's when we see this event as it is and as organized as it is, it's easy to kind of forget that the birth of this Quality Summit was a bit cesarean when we first started out. And, there was a group of hardy people who took those kind of the science fair approach with the trifold cardboard and carefully cut out the construction paper and used Elmer's glue to put them all together. And we had fits and starts, but through it all, Dr. Marcy Nelson championed the Quality Summit and supported it literally and figuratively, and led us to this institutionalized summit that we have today. And it's in her honor that we have named this Summit Award. So I'd like to invite her up. And help us with the presentation. And, for those of you that may be new, obviously this isn't a memorial award. This is a legacy award. We really appreciate Dr. Nelson coming here and participating with us. So we have struggled as an organization to figure out what to do with the epidemic of mental illness in our area. And it's easy to be distracted as an organization trying to figure out how we deal with root causes. We have tried on multiple levels how to address that with the community. And as Dr. Miller said, there's only so much that we can do as an institution. So some time ago, we determined to take the resources that we had available and put it where we as an organization need it most and where we could do the most good for our community. And that has resulted in a couple of programs that have very much benefited the patients that come into the emergency room, as well as the increasing number of people with mental illness that are in our inpatient beds. And so it is with great pride and pleasure that we award this the Marcy M. Nelson Memorial Summit Award to our Behavioral Intervention Support Program and our Behavioral Emergency Support Team. And I'd like to invite Jennifer Enciso, our RN nurse manager in charge of behavioral health, as well as Dr. Ahmed Abawesh, our psychiatrist.
Yes, please. I think there was a bet that I wouldn't write something, but I beat all odds and did write something. So it is a pleasure to be here and for the BISP unit to be recognized it was a breech delivery, so it was a difficult one. But 8 to 9 months into it, what an ingenious idea, and what a wonderful idea it has been. We have impacted more people and treated more people in the past 8 months than we have in 4 or 5 years. So I think it's just a wonderful idea. On behalf of the BISP unit and its staff, I'm truly honored to accept this award. This recognition is a tribute to the incredible people who make up our team, each of whom brings unwavering dedication and heart to everything they do. On the BISP unit, excellence isn't just a goal. It's a daily standard for us, whether it's at the bedside, behind the scenes, or within our community. Our team leads with compassion, integrity, and resilience. Especially in the face of recent challenges across the healthcare landscape, our staff have shown time and again that they are not only skilled professionals, but deeply committed caregivers. This award is not about one moment, but about our culture, a culture of teamwork, innovation, and an unrelenting commitment to putting patients first. It reflects the hours, the sacrifices, and the values we all share. This is truly a unique program nationwide. It has taken parts of every emergency intervention in mental health and put it together in a very compact and efficient way. We couldn't have designed it any better. From having beds assigned that are ER beds, to having a rapid response team that sees patients as soon as the call comes in, to cooperating with Butte County Behavioral Health and moving patients through. I think we've just had a huge impact that I'm really proud of. To our colleagues, our leaders, our families, and our community, thank you. Your trust and support makes this work possible. Your belief in us drives us to keep growing, improving, and healing. We accept this award with gratitude, with humility, and with pride. And we remain committed to the mission of Enloe Health to elevate the mental health of our community. Thank you.
I don't know how I'm supposed to follow that, but I'm going to do my best. Good evening, everyone. I want to take a moment to highlight 2 essential aspects that define the success of the program, its impact on our organization, and its impact on the community in which we serve here at Enloe. In the 8 months since the program went live, we've seen an incredible transformation. We've cared for over 450 individuals in the overflow area upstairs, a clear reflection of how significant the need was and how powerfully we've responded. Even more impressively, we've given back over 12,800 hours to the emergency department. That means more. Thank you. That means more available beds for those in critical need. It means faster treatment, improved outcomes, and less strain on our emergency services here at Enloe. And let's talk about safety and support. Since the implementation of the BEST team, they've successfully de-escalated over 353 individuals in the organization. This not only protects our staff, it preserves dignity and compassion in moments of crisis. Following their deployment, Enloe Health experienced something truly remarkable. 2 consecutive months with 0 code grays called in the hospital. That's a milestone that speaks volumes here at Enloe. But none of this would be possible without teamwork. From the unwavering support of our senior leadership, to the flexibility and dedication of staff in the BISP, to the tireless collaboration between departments and disciplines, everyone played a role. We made sure our mental health patients received the care and support they need, whether they're here for psychiatric or medical reasons. The need was clear. Enloe urgently needed dedicated psychiatric resources for our inpatient and emergency departments, and a team of 19 psychiatrically trained professionals stepped up. They brought with them expertise, passion, and a shared mission to improve patient outcomes, emergency department throughput. I should have got this unstuck before. Left without being seen rates, workplace violence prevention, and overall staff safety. And perhaps most importantly, they created a healing environment, one that offers stability and dignity for patients awaiting inpatient psychiatric services away from the controlled chaos of the emergency department. Thank you all for being a part of this journey.
Before I let Dr. Aboesh and Jennifer leave, it should be said, I was waiting to see what they would say. It's no surprise they didn't talk about themselves, but first of all, I'd like to give a shout out to Donna Larson, who was the senior administrator that championed this, and we owe a lot of debt of gratitude for helping put the program together. But I'd like to just talk about these two for a second, because what this amounted to was a redeployment of our psychiatric resources within the organization. Now that sounds pretty technical and bureaucratic, but what it meant was that a lot of people had to change jobs, and they had to change their job description. And it was, I imagine, pretty scary for them, not knowing how this was going to turn out. Would it be one of those things that we started and decided we couldn't do, and now everybody's out of a job? So I want to thank these two for shepherding that and for convincing people that this program would work. Thanks.
Thank you.
Just a sample of some of the phenomenal work that goes on every day, every week, every month here at Enloe. Congratulations again to our 3 award winners this evening. There are 85 total posters, so 82 other posters hanging up if you want to take a few minutes to peruse through those. The decision for the winners was extremely difficult. We had to break it down by data points. We had to break it down by the presentation. We had to break it down by the lives impacted, the hours impacted, the quality of care impacted. So please take a little bit of time, enjoy some of the hard work that was done here at Enloe. And again, this is not an end all to our quality. This is a waypoint on the journey. Go out, continue to do the quality work, the excellent work that you do each and every day, and thank you all for coming.